This is Average Joe PT, where we're here to reduce pain, reduce anxiety, get you moving.
That's right, you're changing things.
I know, I'm changing it up a little bit today. Well, today we're going to talk a little bit about the neck. And so let's go ahead, we're going to get this model out here just for a second and kind of give us an idea when we're talking about the neck, what the heck's that really mean? That essentially means everything from the base of your skull, back here to the old noggin. Right, Scully?
Yep, yeah, I got one too.
All the way down through this entire purple spot that I see here. So it goes all the way down. There's 7 bones, and we're going to go over those a little bit today. And so go ahead and stay tuned. So when we look at these 7 bones that really make up our neck, they're very small. And like I always like to show you guys, if we took and kind of popped this out, it kind of gives you an idea of really one vertebrae bone on another one with a disc in the center. And so in the neck, they're the smallest. These bones are the smallest in the neck, and a lot of the muscles go from the neck onto the shoulder blade and vice versa. And so when you have a lot of neck pain, you can get pain that goes from your neck to your shoulder blades and mid-back and then back up, because those muscles cross those joints, as well as muscles that cross the base of the skull. Those kind of yes and no muscles, they cross from the base of the skull also to the neck and can give you a lot of what we call suboccipital headaches. So I'm just going to kind of point up here if you want to go ahead and look at some of the neck treatments that I put into my channel. You can look at that, from massage to the TENS units to ice to stretching techniques to postural education, taping techniques. I've gone through a myriad of different techniques to help reduce your overall neck pain. If you have any comments, just leave them down below, positive or negative, that's fine. I'll take either or. If you'd like to subscribe to our channel,
you should probably subscribe, please.
Sully says subscribe. If not, hopefully you like the content anyways. Now in this neck, like I said, it's very small, those bones are, and also the discs are very small in your neck. And so each vertebrae, each bone or spinal piece in our neck has a disc in between it. And so when you're doing a lot of lifting, pushing and pulling, a lot of people try to start to strain their neck. Or if you're into, let's see, those industries where you kind of use your head a lot more, let's say people who put up sheetrock and they kind of hold the sheetrock in place, that can really mess up your neck a lot. And so the most significant injury that happens is at what we call the C6, C7 level. And so that's because most of the movement, half of all your movement looking up and down, occur from that segment. And so the disc, takes a lot more stress in that area. As well as you can get a lot of arthritic changes in that joint that I always talk about here, right on the sides. So those facet joints that I talked about in my last video, if you wanted to look at that, it's on that channel here. Talks a little bit more about facet joints because we talked about it in the low back, but you can also get the same problem in the neck and give referred pain down the side. And so you have to be mindful. Everything that is huge down below in the lower back in regards to the bones and the discs have the exact same problem up above, but are a lot more magnified because the discs are a lot smaller, the bones are a lot smaller, and a lot of things are closer together. There's an artery that comes down through here. All those spinal nerves that come off the spinal cord come all the way down through this neck area. So when there's any type of surgery that needs to happen because the disc is just gone, let's say they found it in the neck and in the lower back, they're going to go ahead and do surgery on the neck before they do anything on the lower back, because there is so many more vital things that can go wrong in your neck versus down below. And so that is the main concern in regards to that piece of it. Now, the other huge thing when it comes to the neck is kind of dizziness, lightheadedness you can get. And a lot of times you can get that is because all the muscles that run from the base of the skull and that go onto the spine itself can give you a lot of those symptoms up above. Whiplash injuries, traumatic brain injuries, all those types of things that affect those muscles up in here. The constantly looking down at your tablet or your phone can give you a lot of those symptoms too. So be very mindful of how you're putting yourself in certain positions throughout the day when you're doing it for long periods. We're talking hours at a time. And so if you have any questions, Scully and I are here. Hopefully leave some comments down below. But until next time, Scully and I always like to say, look up and keep smiling. See you next time, folks.